Good afternoon, everyone. I'm Doug McGowen with the City of Memphis, representing the Joint Task Force for Memphis and Shelby County. And today we're starting what will be the first of our weekly task force updates. I'm joined today by Dr. Alisa Haushalter and Mayor Lee Harris, who will be giving you some updates. But today we know top of mind for everyone is the changes that Governor Lee has made, and you're probably wondering what effect that will have on us locally. I want to be clear, though, that the order Governor Lee gave was applicable to 89 counties. We still have a health order that is driven by the health department here in Shelby County, and Dr. Haushalter will talk to you about some of the changes that may be coming forth in a new health directive that will be issued from her office. Now, those changes are only going to be possible because of the broad-ranging compliance that all of you have had over the past few weeks that are really driving our numbers down. That is, wearing your mask, following good hygiene practices, and following social distancing. So our success in the future will be contingent on our ability to follow any new guidelines that may come out from Dr. Haushalter's office in the health directive. We also know that this pandemic has affected everyone pretty dramatically, small businesses, artists, entrepreneurs, and I want to reiterate that there is help available. If you'll go to covid19.memphistn.gov, you will see a compendium of resources for small business owners, for artists, for folks in the hospitality industry, and people in the beauty industry. There is help available for you, and we hope that you would go there and receive some of those resources. Also, we have heard from you that testing is important and ease of access for testing. As you know, we have 2 community-based testing sites. There is one at RKS Commercial Cove just off Lamar Avenue, and there is another just off Appling Cove right off of I-40. Those are community-based testing sites, generally open Monday through Friday, 8:30 in the morning until 4:30 in the afternoon. The change is this: no longer do you need an appointment. Drive up and get tested. If you're feeling symptomatic, get tested. If you're worried that you may have contacted COVID, get tested. Just drive up and get tested. We can do about 11,500 tests per week. We're only using about 25% of that capacity, so please take advantage of the opportunity, drive up and get tested. The last thing I'll leave you with is that though we are seeing our numbers go down, we have been at this for more than 6 months. I know all of you are tired of this. Out of this darkness comes some light. Many of you have been affected by lack of a job and you need a new opportunity. This week, there are 2 brand new opportunities that I would love for people to take advantage of. The first is tomorrow. There will be a virtual hiring event for the Haisong Heiko company that's being put on by the City of Memphis. You have to pre-register, and if you want to pre-register, you can do that through the city's website. Again, look at covid19.memphistn.gov. If you do not have access to a computer, come to any one of our library systems and we will get you registered by about 11 o'clock in the morning and you can participate in that hiring fair. The second is on October 23rd, FedEx is also putting on a hiring fair. That's a combination of the City of Memphis, Shelby County, and FedEx all coming together to offer a wonderful opportunity for people to be hired in our community. So there are opportunities out there for you. There is help available on the website, and there are jobs aplenty here in Memphis and Shelby County. So we encourage you to take advantage of those opportunities. Again, I'll turn it over to Dr. Haushalter, who's going to talk to you about some of the changes coming in our health directive.
Thank you, Chief McGowen. Good afternoon, everyone. Alisa Haushalter, Director of the Shelby County Health Department. This afternoon, we're going to change our process just a little bit. So I'm going to give an update on data as I generally do, talk a little bit about the changes you can expect in Health Directive number 13. Then we will open it up to question and answers. And then around 12:30, I ask everyone to stay on. I'm going to turn it over to Mayor Harris, and some of our guests who are here with us today are going to highlight some of the museums in Shelby County and how they've been able to open safely. We really want to encourage people to get back to using our amenities locally, so please stay past the 12:30 time to be able to hear that information. As of this morning, we had 32,306 cases. That's an increase of 258 reported in a 24-hour period. I want to note that that's reflective of many days of testing. So even though we saw that increase yesterday, that's a reflection of tests not being reported as opposed to an increase in cases. We are still trending downward and doing that very slowly and incrementally, but as Chief McGowen pointed out, that's a testament to all of the work that's happened in Shelby County. Unfortunately, we have 490 deaths, but that's still representative about 1.5% of our overall cases, so that's still positive for us. For those who have recovered or viewed as inactive cases, that's 94% of our cases, or well over 30,000. So the majority of people recover and do quite well. We currently have about 1,400 active cases that are still in that process of recovering. What's most important is that our contact investigations are going well, and to date we have been able to close approximately 86% of those contact investigations, and to date we've identified over 28,000 contacts. Today we have over 6,000, almost 7,000 people who are in quarantine. I want to pause for a minute and talk about those things that are critical as we move forward, and then talk about the health directive. We have referenced previously that there are key areas that we need to continue to focus on. One is communication, and particularly getting messages, the right message to the right people at the right time. So focusing clearly on the community more broadly, but also businesses and others, so that they have information to make sound decisions. The other is case investigations and contact tracing. Many employers are helping out by assuring that they keep a safe and healthy workplace, not just to prevent the transmission of COVID, but also to help identify cases and exclude them from the workplace. It is critically important that employers notify the health department when they have a positive case amongst their employees. That allows us to partner with them to be able to isolate and quarantine people in a very timely manner. The third area is enforcement. As we've said before, we'll be laser focused on enforcing the health directive, but specifically focusing on those businesses that are non-compliant. Preview one of the changes in the health directive. One of those is that if a business is closed, it may take up to 2 weeks for us to be able to work with them to implement a plan to reopen. So it's quite different than what we've been doing previously. So we want to make sure that people are aware that enforcement component will be both surveillance. We'll just go out and randomly look at businesses. We also will respond to complaints that come in. And our restaurant inspectors, as part of their routine inspections, are also looking at compliance, particularly to masking and social distancing, which we know are critical. The last is testing, and as Chief McGowen mentioned, we have significant testing capacity in our community. It is being underutilized, so we encourage people to get tested, and as was noted, at 2 of those sites, an appointment is no longer needed. Additionally, because of Hispanic Heritage Month, we noted in September that both September and October, we would have specific events that are targeting or at least trying to improve access to testing in the Hispanic community. So on Saturday, October 10th from 10 to 1, there will be testing at the St. Joseph Catholic Church on Neely Road. And for more information, you can go to Shelby TN Health. So last, I want to talk about Health Directive number 13 and what you can expect when it is posted. There are actually minor changes, but for some of you, there are ones that you've been anticipating. We will allow restaurants, including limited service restaurants, to remain open till 12 o'clock. However, I want to point out that even though they're allowed to be open, there's an expectation of compliance and adherence to all of the health directive measures, including social distancing, masking, and so on. For a table, previously we limited the number of people who could be seated at one table to 6. We're going to increase that number to 8. And then everyone has given feedback, or a large number of people have given feedback on the distancing that we've allowed at sporting events. So if you recall, for indoor events, initially we were at 18 feet. We decreased that to 12 feet. We haven't seen any increases in transmission as a result of that. So for sporting venues, we will reduce the social distancing to 6 feet from one group to another group. And that will have a significant impact on many of our venues locally. I also want to reinforce what I said earlier for enforcement. We really strive to educate business owners, stay engaged with them, and provide technical assistance. But for those who elect to be non-compliant to the health directive, we will close those facilities and they will remain closed for approximately a 2-week period or until such time that they have a plan approved by the health department. So I'm going to pause there and open it up for questions before I turn it over to Mayor Harris.
April Thompson, WREG.
Yes, can you hear me?
Yes.
Okay. Good afternoon. I was just wanting to ask about one thing you said about enforcement and that you all were cracking down on the businesses. How proactive are you being as opposed to going out on violation calls? How proactive are you as to try to find out if there are problems ahead of time?
So we're doing both. As I said earlier, our restaurant inspectors that do typical inspections, each time they're doing a restaurant inspection, they are looking for compliance. We have teams of individuals who are out, then they will generally go by geographic area or sometimes they'll go by type of facility, and they do that proactively. We specifically have teams out on the weekend, and that includes Friday and Saturday and Sunday night. I think a lot of people think that we're not out, but those teams are out. And again, it may be by geographic region, and they may move from weekend to weekend, or it may be a specific type of facility that they're focused on. And then we also respond to complaints that come in. One of the things that happens, unfortunately, is oftentimes on Monday we'll get complaints that were over the weekend. So it's really important that people contact us as soon as they know that a business is non-compliant. And they can do that by calling 222-MASK, M-A-S-K. And your follow-up?
Yes, I did have a follow-up. We're in Health Directive 13 right now. Where does that say on how we're doing and the direction we're going and what you all foresee about being able to open up even wider and almost back to normal?
So at the current time, well, a few things. Let's just say we're not going to be back to normal for some time. There will always be restrictions in place until, one, we have a vaccine and we have significant numbers of people who are vaccinated. So anticipate that there will be ongoing restrictions, including the need to wear masks, social distance, limit travel, and so on. But for businesses specifically, the only ones that are currently closed are adult type venues or adult entertainment venues. We are still limiting parades and other large festivals. However, we review any of the plans that come in and try to work with the event organizers to assure a safe event if at all possible. So at the current time, there's really not much that's closed. It's the focus on social distancing and masking that's going to be critical. And then, as I said, for businesses, and particularly managers and owners of those businesses, to work with the health department on contact tracing if and when there's a case.
Chris Luther, WMC.
Hello, can you hear me okay?
Yes.
So with the change in social distance guidelines for sporting events, I'm assuming that applies to both the University of Memphis and for high school football. And if you are an avid sports fan and watching college football games on Saturdays, there are some places around the country where many of the fans aren't even trying to wear a mask, not necessarily at University of Memphis games, but my question is, will you be watching the University of Memphis crowd in the Liberty Bowl and taking the same approach as local businesses in terms of compliance with those masks, and then potentially pulling back on loosening restrictions if those masks are not worn by fans? And then I have a follow-up.
Yeah, so two things will happen. Yes, we will do some monitoring ourselves, but for any of the event spaces, we have an expectation that they do monitoring themselves. I know there was a football game over the weekend where fans had to leave because they were not masking. So we actually have to rely heavily on leaders, management, and the organizers to do enforcement within those particular venues. And we also, let me add to that, we do have to rely on the public. I think it's really important to point out that our numbers are in a good place because we've had such compliance. So it's really important that individuals do wear their masks while out in public and that they adhere to social distancing rules. And your follow-up?
Yeah, follow up on a different subject, and I know you've spoken about this before, Ms. Haushalter, but the Tennessee House Speaker Cameron Sexton visited the Memphis area yesterday and explained a little bit more about his proposal to give politicians more power over local health departments. I just want to know if you, your thoughts on that proposal, if you've had any discussions with the House Speaker. And then I don't know if Mayor Harris, I know he's there, if you would comment as well about, you know, the idea that politicians should get a little bit more control back for future, you know, situations such as this in terms of making a health department more advisory role rather than in control of directives and things of that nature.
So then you had a couple questions there. I'm going to try to respond to them and then turn it over to Mayor Harris. No, I did not talk directly to Mr. Sexton. However, I'm open to do that. The only other comment that I'll make is that we're very visible because of the pandemic. But the public needs to understand that local public health authorities, including the 6 metros, actually use that authority every day to make sure that we have a safe and healthy community for all people. And that includes our ability to shut down facilities that pose a risk to this community, our ability to isolate or quarantine individuals who have infectious TB, or to shut down a hotel or motel that may have Legionella or some other infectious disease. It's important that we have the ability to do that in a timely manner to make sure that we have a safe community. So just encourage people to think about our role, not just during the pandemic, but each and every day. And then I'll turn it over to Mayor Harris.
Thanks for that question. I also have not heard from the Speaker, Cameron Sexton, and that may be a sign that some of the COVID pandemic response has become a little too political. I think that it's probably a good idea if there's going to be a conversation around restructuring how we respond to this global pandemic, that there be a conversation with some of those county mayors, that there be a conversation with the urban county health departments, including the Shelby County Health Department. So I think, you know, unfortunately, we see it nationally, and now we see it a little bit too much at home. I think that all of us want to have those conversations. We want to have serious conversations around how to structure the pandemic response. For example, on our side of the table, as it were, we believe that a comprehensive approach is probably the better approach. In other words, we know that the virus has no borders, and that if there's an uptick in the rural areas, that uptick could affect our urban areas. And so we would love to see a more comprehensive approach at the national level, or as it may be at the state level. So I think there are lots of different ideas about how to restructure. We know how this was started. You know, the executive orders and so forth, and we all have ideas. I just would welcome the opportunity to talk to the Speaker, and I know the Health Department is available and open to talk to the Speaker about how we might restructure the pandemic response. Thanks.
Dominique Dillon, Fox 13.
Hi, my question is regarding the CDC's new information that COVID is airborne in certain situations. What is your take on that information? And do you suggest, people not go to certain places where there may be poor ventilation, or should they take President Trump's advice to not be afraid of COVID?
So that's a great question, and I would just state from a public health perspective, the information released from the CDC late yesterday is really what we expected. For those who work in infectious diseases on a regular basis, we know that there's an interaction between the host, which is the person who can become ill, the environment and the properties within the environment, such as air circulation, as well as the agent, which in this case is COVID-19. What happened is, because this is a novel virus, there wasn't research that supported exactly when and how likely COVID was going to be transmitted. So this just really puts in writing what most of us had anticipated based on other respiratory diseases that we work with. In reviewing that, it does not change our current plan locally. So we have, throughout the pandemic, really encouraged individuals to make solid choices and personal choices about where to go and where to spend their time. And I think the report from the CDC just highlights the importance of that. If an individual has a chronic illness, if someone is over 55, they really need to think about where they're going to go, what that space is like, whether they're indoors, outdoors, how long they're going to be there, what activities they're going to engage in, and make sound decisions about whether or not they should or should not travel. And you have a follow-up?
Yes. Also, is there an update on the COVID vaccine or prepping for a COVID vaccine through the flu vaccine?
I don't have any specific updates since the last time the question was posed. There's a lot of things in the works, and there's some potential research opportunities, and perhaps we can share those in an upcoming session.
Brad Broders, Local 24.
Thanks. Good afternoon, Dr. Haushalter. I think I asked you this when we had Health Directive number 12, but what for this Health Directive 13, what specific factors did you all take into account to feel comfortable with making these changes in the social distancing and the midnight extension?
So we continue to look at the 4 gating criteria that were established in the beginning, specifically the scope of the pandemic locally, but also over time we have improved our data collection methods at the local level so that we can more effectively and in a timely manner identify particular sites where there might be clustering or transmission occurring. So that data is important. An example that I'll give there is the closure of limited service restaurants. We had to close them proactively based on data that was coming from other communities. As time has gone on, we actually have added data elements that allow us to be able to determine if there's an outbreak associated with one limited service restaurant. So we can focus on one business, not all of the businesses in a given category, because we have better data collection methodologies. The other is test results come in very quickly now. If you remember back in July, they sometimes were taking weeks to come in. There was one lab that actually had labs reported at almost 60 days out. So now we're getting reports in 1 to 3 days, and that it allows us, again, to more quickly do that investigation and use that data to be more tailored. So that's important. The other is hospital capacity, which remains very good in our community. Testing capacity, which has been noted several times today. We have plenty of capacity. It's not being utilized. We encourage people to get tested. And then the last is public health capacity. And within public health is one, that ability to analyze data and use that data to drive decision making, which I referenced earlier, but also our ability to do the case investigations. And as I noted, many businesses now are partnering closely with the health department to help facilitate that process. And so we are able to get people isolated and quarantined more quickly in Shelby County, and all those things together say that we can move forward at an incremental basis as long as we're monitoring, and that we're ready to pivot back to a faster pace if we begin to see more cases.
Thanks, Dr. Haushalter. And as a follow-up, I know I'm seeing a lot of tweets from a lot of Tigers football fans excited about the new social distancing requirement. Do you have any attendance capacity, you think? I know there was 4,500 for the first game. Could it be more than 9,000 fans? Do you have any rough ballpark on how many could attend football games now?
So the focus really is on social distancing, so I would have to defer to the University of Memphis to say what that number would be based on their calculations, because I don't know off the top of my head.
Laura Testino, Commercial Appeal.
Hey, wanted to ask, confirm for sure when the new health directive will take effect.
So it'll take effect today. Our goal is to get it posted this afternoon. So if it's posted this afternoon, it would go into effect today.
Okay, so that would be starting, later this afternoon, or is that 12:01 tomorrow morning?
We'll say 12:01. We'll make it easy on you, 12:01.
Okay, I appreciate it. Thanks. And then as a follow-up, if you could just describe, now that bars have been open for a little while, and contact tracing, I understand you guys have developed some new tools in that area. Are you hearing from people voluntarily as you're doing tracing? Are they telling you what bars they've been to, trying to get an understanding of how quickly you guys might understand whether transmission is happening in any sort of bars as these?
So that's actually one of the questions in the interview tool. So when we do a case investigation in public health, there's really an expectation that people cooperate. And so we do rely on people to be truthful, but that is one of the questions. We also ask if they've been to a sports venue, if they've been to a restaurant, if they've traveled. So it's a fairly exhaustive list to allow us to pinpoint more closely. And then we're going to take one more question so I can turn it over to Mayor Harris.
Jane Roberts, Daily Memphian.
Do the new changes include indoor venues for sporting events?
Yes, ma'am.
Jane, did you have a follow-up?
I do not, thanks.
So I'm going to turn it over to Mayor Harris and really encourage everyone to know that many of our businesses are open and that they can be frequented if we adhere to the safety measures. Thank you. Mayor Harris?
All right. Pleased to be back here again. I continue to talk about ways we can support and help the most vulnerable groups in our community, those that are the hardest hit by COVID-19. And today we want to talk about our at-home learners who have really borne the brunt of the COVID pandemic in a whole lot of ways. And we have some special guests to introduce here. And this should only take just a few minutes. So pleased to announce this latest program to help our virtual learners, and it is called 901 Student Passport. Information can be found at 901studentpassport.com. And this program acknowledges the fact that in this COVID era, our at-home learners are not able to partake in the usual field trips. There are no buses being run. There are no carpools, or carpools are discouraged, but we still want to make sure our students get exposure and get experiences even during this era of COVID and even while they may be virtual learners. And so 901 Student Passport creates an opportunity for free admission to some of our community's most cherished assets. We have several of our partners here to talk a little bit for a minute, no more than 2, about their programs and how they're navigating the COVID environment to provide a very safe experience for students and virtual learners. So at this time, I'd like to invite the first program participant to the podium, the Fire Museum, which again, all of these programs will provide free admission to our student learners during the pandemic. So the Fire Museum, if Kim would approach the podium. Come on, Kim. Where's Kim? There she is. There she is. There we go.
Thank you, Mayor Harris. We appreciate this program more than you can imagine. At the Fire Museum, we see a couple of thousand, 3,000, 4,000, 5,000 students every year that we teach fire safety to. The students can come into the museum and learn how and when to dial 911, how to get out of a structure fire safely, and how to basically stop, drop, and roll, and all of the safe things they need to stay safe. But the most important thing they learn is how and when to call 911. So we are so excited that we're going to have kids back in the museum and that we'll be able to teach them these life and safety rules.
The next museum is the Memphis Rock and Soul Museum.
Thank you, Mayor Harris. In most regions around the country, music falls under arts and culture. And we know here in Shelby County, it goes much more in depth than that. It's part of our history. It's part of our background. It's part of really who we are as people. And we want students to celebrate that. The Rock and Soul Museum's exhibit, which was developed by the Smithsonian Institution, introduces our students to a lot of other students. Students like Isaac Hayes and Jimmy Lunsford, who came out of Manassas, or Alex Chilton, that came out of Central, of course, Maurice White, David Porter out of Booker T. Washington, so many others that provide for our students a great example of how to change the world the same way that they have changed the world through their music. So we appreciate Mayor Harris. We appreciate the opportunity to have these students back in the museum and to encourage them not just to learn from these other musicians, but to experiment with their own creativity and energy and to change the world themselves. Thank you, Mayor Harris.
All right, at this time I'd like to welcome to the podium the Slave Haven Underground Railroad Museum.
Thank you, Mayor Harris, and others in your administration for making these tours available to the students in the Shelby County schools and making Slave Haven Underground Railroad Museum a part of this endeavor. There's always been a lot of fascination and mystery surrounding the Underground Railroad and its secret operations known as the first civil rights movement in America. Slave Haven Underground Railroad Museum, located right here in our own city, was one of those secret locations where enslaved Africans sought refuge on their journey to freedom. We believe that the students from Shelby County schools will be intrigued when they visit the museum and learn invaluable lessons of courage and perseverance that will impact their lives. They will experience a history lesson that they will remember for years to come. So Memphis is fortunate to have such a unique treasure in our city where students can come and get an up-close look into history and walk in the footsteps of those who came before them. We look forward to being a part of their learning experience and with their parents. And so thank you again, Mayor Harris, for this opportunity, and we expect to have hundreds, even thousands of students to come to us.
Well, thank you, and the free admission lasts at least through the end of the year. Lichterman Nature Center, welcome.
Hi, I'm Kevin Thompson, the Executive Director of what we're now calling Museum of Science and History, which encompasses both Lichterman Nature Center and the Pink Palace. And Mayor, we're just delighted to be a part of this program. Thank you very much. We serve over 130,000 kids annually, sometimes up to 140,000. So this has been a dramatic change for us with COVID and the lack of field trips. We all have that teacher, though, that taught us the foundation through, school and book learning. But we provide that experiential and that tangential learning experience for students. And that's what gives us the vision, that's what gives us the inspiration to go into a career or a field or just to learn something more about a topic. And that's what we're all about, whether it's history and culture at Pink Palace or science, or nature and outdoors at Lichterman Nature Center. So please take advantage of this program and come out and see us. We are delighted to host and very much looking forward to this program. Thank you.
All right, at this time I'd like to welcome to the podium the Dixon Garden Gallery.
Well, I'd just like to echo my colleagues in thanking Mayor Harris and his staff for recognizing the importance of the arts in the lives of Memphis students, Shelby County School students, and more importantly, doing something really meaningful about that. And the Dixon has a long history of participation and collaboration with Shelby County schools. We founded Art to Grow 20 years ago, a mobile outreach program that delivers and students every discoveries our reach thousands of students every year, and to tell you about our free, not just a science teacher, has Shelby County students and their families. We'll ask them to wear their masks, ask them to social distance, and ask them to have a great time as they enjoy the wonderful experiences that are to be had at the Dixon Gallery and Gardens. Thank you very much.
Very good. And our final presenter, the Memphis Brooks Museum of Art.
And I think the National Civil Rights Museum might be joining in as well. But hello, everyone out there. I'm Emily Neff. I'm the Executive Director at the Memphis Brooks Museum of Art. We are so very grateful to Shelby County Mayor Harris and Chief Inez for offering this opportunity of sort of shedding light on all of the great cultural assets we have in our community and matching that with the students in Memphis and the region. We really hope you'll come visit us at the Memphis Brooks Museum of Art. We are the city's art museum. We have more than 10,000 artworks spanning 5,000 years of human creativity, spanning just about every continent except for Antarctica. So we truly do provide a passport to the world for all of you. So I would also add that, as we like to say, that multiculturalism is a part of our DNA, and we are a great place in which to encounter world cultures and learn about a multiplicity of perspectives. I think all of us here, we are keenly aware of what art does for everyone. It educates, it enriches, it inspires, it heals. It's a form of wellness, and we all need that right now. I think we'll agree with that. And it sparks creativity as well as critical thinking. And we know from scientific studies that great art experiences develop the whole child. And so in terms of this very challenging period in which we are all living, in which many people are in isolation and quarantine, experiencing school remotely, this sort of very fractured political environment that we are in, just remember that art museums help to develop the whole child. So this is a great time to come visit all of these cultural assets. Thank you again, Mayor Harris, for opening the doors to everyone in our community.
All right, and I misspoke. Actually, our last presenter is our National Civil Rights Museum and the extraordinary Terry Freeman.
Thank you, Mayor Harris. Thank you especially for including the National Civil Rights Museum in this project. About 75,000 students are a part of our annual visitorship at the museum. And for me, one of the saddest parts of this particular pandemic is that we have not been seeing the yellow school buses outside of the museum. So we are thrilled that we are included. You know, right now at this moment when we see civil unrest occurring in our communities across the country, is a really good time for young people and their parents and guardians to learn about the history of the civil rights movement, and for young people to know that no movement has ever started without young people being involved. So we welcome you to the National Civil Rights Museum. We look forward to you coming to visit, and again, thank you, Mayor Harris, for including us.
So thanks very much to all our partner museums. Thanks to the City of Memphis, which is partnering and making the City of Memphis libraries one of the locations where you can pick up your own passport. If you are a student or virtual learner, come to one of the libraries to pick up a passport, or go online at 901 Student Passport to print off your passport. If you visit all these museums and get a passport stamp from all these museums, you'll be enriched. But in addition to that, we'll send you a very, very special gift for visiting all of these museums. So thanks very much again to the partners, and we're hopeful that lots of our students will take advantage, because arts, history, and culture is so important. Thank you. That's it.